Hello, my name is Tom. I was diagnosed with high blood pressure about 15 years ago when I was in my early 40s, and it progressively got worse over time. I tried everything to try and remedy it, diet, exercise, medication. I saw a bunch of different doctors. I was given different types of medication, more and more medication. I was given potassium pills because I had low potassium. The potassium pills, like blood pressure pills, have side effects and create other issues. So I was dealing with that. I was gaining a ton of weight. There was a point where my blood pressure was running about 200 over 100, even with a large amount of medication, blood pressure medication. Ultimately, I went and saw a specialist and was diagnosed with an aldosterone producing tumor on my adrenal gland, Conn syndrome. And I started looking at my options to remedy the situation. I went to the Fred Hutch in Seattle. They proposed a surgery to have it removed. There was, like I said, I asked a lot of questions of the doctor before deciding to have surgery there. And ultimately, I chose not to have the surgery there, basically because their process was very intrusive. They went in through the stomach. You got to move a bunch of stuff around to get to the adrenal gland. They were going to take the entire adrenal gland out. Ultimately, I was fortunate, and I found Dr. Carling at the Carling Clinic in Florida, and his procedure was a lot less intrusive. I went down, I met with him, talked with him, and essentially they go in through your back, and they take only the portion of the adrenal gland that needs to come out rather than the entire adrenal gland. And after talking to him, he does the surgery much more often than the doctors in Seattle do. It's a kind of a rare surgery for them there, and the Carling Clinic specializes in it, so they're doing it many times a week, as opposed to 3 or 4 times a year for most doctors that do this type of surgery. I went down, and it was about 2 years ago. I had the surgery. The surgery was really easy, obviously, because I was out, but the recovery was easy. I was a day and a half in the hospital one night, where they monitored me. My blood pressure pretty much immediately normalized. My potassium situation immediately normalized. I was no longer having calf cramps, no longer having headaches. Now, a couple years later, my blood pressure is still completely normal. I'm running like 110 over 70. My potassium's normal. I've lost 30 pounds since the surgery, and I'm very thankful to have found Dr. Carling and the Carling Clinic in Florida. I would highly recommend it to anybody that has this issue. And even if you don't know you have the issue, I would ask for to get a test to find out if you've got an aldosterone producing tumor, if you've got high blood pressure. From what I understand, there's a 10% chance if you have high blood pressure that's why it's happening.